So the next thing, like who should I be looking to do this procedure for me? Like, what am I looking for? What's the right combination?
Okay, I know it's always a cost situation, but I promise you, you get what you pay for in a lot of circumstances. For my younger generation that we talked about, under a year, yes, you can get away with low cost conversations, right? I know it doesn't come with a lot of quality care. IV catheters, IV fluids under anesthesia, the type of anesthesia, post-op pain meds. Sometimes you don't even get an e-collar or a party hat to go home with. So what does that tell me about the facility or what you intend to do after this situation is done?
Right. So I want to make sure it's a licensed veterinarian professional, first off.
But even licensed veterinarians
might be cutting some corners, but we want to find a licensed professional that has experience.
Yeah.
Don't want somebody that says, "This is my first time doing this."
That's a no-brainer to me. That's a no-brainer to me. But in the thick of it, you really want to be sure, you're communicating effectively what your expectations are. That's real.
And you're mentioning the difference between quality and quantity, right?
For sure.
So that's something to look at.
Yeah.
And the patient's needs.
Patient's needs. If I'm older, I don't recommend you go to low cost. It's low quality. And we talked about some of those other circumstances that are already in the queue of issues that are happening. And you don't want to cut those corners because it's going to hurt. Plus, they've already had a lot of maturity in those organs that are about to be removed, which equals pain, more blood flow. And if you don't have appropriate pain meds, sometimes antibiotics or fixed problems in conjunction with getting it done at that age, the pet kind of suffers in silence too. I've been under the knife before. I don't want to wake up in any pain or discomfort, to the best of my ability, and give me some pain management, because it wasn't a good experience for me. Right? Your pet can't talk to you, so yeah, you got the job done. Yeah, it cost you little to nothing or in your budget, but just understand you're not really setting that pet up for like a successful conversation post-op, and they got to deal with it.
Right. Some of the things you can do too is we don't want to stick totally to reviews, but there are reviews out there that you can look at what people did.
Yeah.
I caution people all the time when you're checking somebody's reviews, if you have one good review, that's probably represents about 100 good cases. And if you have 10 bad reviews, it was probably 12 bad things that happened, because people review negatively much quicker than they do positive reviews.
Oh yeah, man. I mean, I had to beg my clients sometimes back in the day.
And they don't do it if everything went good, because they don't have any problem. They don't have anything to think about.
Out of sight, out of mind, especially at the ER. I mean, you're going to spend $5K, $10K maybe. You want to say, great job, doc, you helped me, but I hope I don't ever see you again. and I agree with you, but you're not going to be like, I can't wait to write this big, great Yelp review for Dr. Owens.
It's done. It's a wrap.
It's a wrap. It's like, hey, I get it. You fixed them, but now what?